Thank you, Doctor, for the presentation. I have the honor to present to you the importance of inclusion in the coordination for HPV vaccine for Côte d'Ivoire. This presentation will be focused on the following elements. We'll present the context of the vaccine against HPV and stakeholders of our some results of the work we did with the stakeholders, and give you the results so you can understand the impacts of working with stakeholders and what the lessons learned and the challenges that we have according the challenges of Côte d'Ivoire regarding the vaccination on the HPV for the years to come. The context, the cancer is a problem because of the women. We have started to implement the vaccination since 2017 to 2015, 2017 into a project. We, on the 25th of November 2019, which means the vaccination of HPV is in every setups. And we have our set of 9 years, and we have administered the 2 doses. And the strategy of the root level is to reach a maximum of women, girls at school, to get them vaccinated. And the vaccine is against the HPV. And the following year, the first semester of 2020, we were able to reach a number of girls with that. And with the COVID, we had a bit of challenges. We have to say that they still have a will to work hard in the vaccination. The stakeholders that we have in the government level, the stakeholders are Ministry of Health. We have been working with a coordination of program and the vaccination. There is a national program, the fight against cancer, and the register of we are in this program not only for vaccination of HPV, but in other projects for elimination of we have a success project, for instance. We also working in a national program against HIV and national program of health of adolescent and youth. That program is involving nurses and everyone that is working at school setup. We are also working with the Direction of Community Health and National Institution of Public Hygiene, and also the Direction of Health, the departmental health department. We are working with the Ministry of Education because 80% of our young women are at school. We are also working with the Ministry of Women, Family and Children, the Ministry of Home Affairs, and that's kind of it was important to use all these stakeholders. That's the governmental aspect. We were also working with the Ministry of Economy. We have also been working with the non-governmental party. There is a foundation that is working in sensitization. It's IG Foundation Against Cancer. We are working with that foundation. We are also working. This is a radio proximity association. We are in we have a very comfortable relationship, and they're allowing us to work with them. The Alliance of Religious for Health, Integrated Health in Côte d'Ivoire, and financial partner, and other uh, gynecology and obstetric associations, and with community and religious leaders. We also have health NGOs. We have been collaborating with this foundation. They are really helping us in terms of communication. This list is not exhaustive. It's not complete. These are some of the organizations that we have wanted to mention. We are also having we have implemented some action, some of them that I'm going to mention. Between the introduction, we have implementation of a consultative technical consultation group. We have elaborated norms and guidelines on the vaccination is done at school. We have to guide teachers because they not always have skills in terms of cancer. We have also chose a focal point at the Ministry of Health, and then the Ministry of National Education. This is really our collaborator. Every time we had needs, he was our focal point and helped us in our activities in these schools. We organized training, strengthening of capacity, which has been introduced. And we have also planned with all the stakeholders the number of girls, the number of schools. Then we have oriented all the directors, regional directors of national education, inspectors of primary education. We have been working with them, and all of them has been informed or sensitized. We also had trainings and sensitization with radio and TV organizations. After the introduction, because the vaccine has been introduced in 2019, we wanted to make sure the coordination of all the stakeholders, so that the coordination still exists until now. And the operational level, the structure that has been working, this organization is central level in operational level. We need to mention that we have in our results, it didn't work as expected. Toward COVID-19, we had to adapt our informations with the colleague at National Education. And still after introduction, we have realized a monitoring with partners, especially JPIGO, who was really involved in this activity. We also have to mention that thanks to our results, which are not really performing, we have a campaign. I would like to present to you the results of our collaboration with other parts and partners. In 2021, in October 2021, we had a coverage of HPV at 32%, and HPV2 vaccine have been introduced since 2009. We cannot even appreciate the result because we only had like 3%. At the end of 2020, we had a 44% 24%. We didn't have enough vaccine, but unfortunately, we didn't really perform. So we had implemented a campaign in November 2021, and that campaign, with the realization, we have intensified collaboration with different stakeholders. At the end of 2021, the result, we went to 116% in HP1, and in HPV2 we have 27%. What are the lessons that we have learned in the collaboration with our partners? We need to say that the choosing of a focal point at the Ministry of Health was really important. So it was something favorable in a school setup. We can say that the vaccination during the extra mile was really important. In operational level, functioning of coordination and education system in some district was inefficient. It required collaboration between the Department of Health and collaborators and school actors. Relationship was a bit not easy. During the campaign that I've just alluded, we have applied education system. It means during the campaign, mobilizators were exclusively teachers, and the directors of these schools has also engaged in the coordination of that activity. This is my last slide. Our challenges is to impulse vaccinations against HPV in routine vaccinations, and to adopt the vaccination against HPV in the educative system, and to form a we are also trying to help healthcare providers on the HPV vaccine model, which is going to be done pretty soon. We hoping that we can keep the HPV, and we're going to organize campaign of vaccination. So I would like to say thank you, because this is the end of my presentation.